Hello, my friends. I'm Dr. Mary Parker, urologist and educator in men's health during the later decades of life. Today, I want to speak to you calmly, directly, almost like we were sitting at the same table, about a standard test that doctors order automatically for men over 70, and about the one question you should always ask before you agree to it. For years, you've probably heard the same message. More tests are always better. Early detection saves lives. If you refuse a test, you're being irresponsible with your health. That message was repeated so many times that it stopped feeling like an opinion and started feeling like a law of nature. But here is the truth that very few people explain clearly. Once you cross 70, the rules of the game change. Your body changes, your risks change, and the balance between benefit and harm from certain tests also changes. What made sense at 55 may no longer make sense at 75. The tragedy is that almost no one tells older men this. You go to the clinic, the doctor clicks a few boxes on the computer, and the lab request appears. Cholesterol, sugar, kidney function, and, almost by default, one more. PSA, the blood test used to look for prostate cancer. It's presented as something simple. It's just a blood test. What they don't always explain is that, after 70, that simple test can open the door to a chain of biopsies, treatments, side effects, fear, and loss of quality of life that often do not help you live longer and in many cases do not help you live better. Major expert groups now recommend against routine PSA screening for most men over 70 because, on average, the harms outweigh the benefits. USPSTF 1. I am not here to scare you, and I'm not here to tell you to ignore your health. I'm here as your guide, as someone who has seen what happens when men are over-tested without proper explanation. I have seen lives improved by wise decisions, and I have also seen men dragged into unnecessary medical journeys that stole peace, confidence, and dignity. That's why, by the end of this conversation, I want you to feel clear on two things: what this standard test really does after 70, and the one question you should always ask your doctor before you let a single drop of blood be drawn for it. Let's name the test very clearly. The exam I'm talking about is the PSA blood test, prostate-specific antigen. For years, it was sold to the public as a miracle. We can catch prostate cancer early and save lives. And yes, in certain ages and risk groups, PSA can help reduce deaths from prostate cancer. But the story is not as simple as PSA good, no PSA bad. Over time, researchers realized something serious. PSA is not a cancer test. It is a prostate activity test. It rises with cancer, yes, but it also rises with many non-dangerous situations. Benign enlargement, inflammation, even after riding a bicycle. That means a high PSA does not automatically mean a dangerous cancer. It just means an alarm has gone off. Now imagine what happens in a man who is 72, 75, or 80 years old when that alarm sounds. The usual next step is a biopsy, a procedure where needles are passed into the prostate to take small tissue samples. A biopsy is not a trivial thing. It can cause pain, bleeding, and infections, and a percentage of men end up hospitalized because of biopsy complications. USPSTF 1. For some, the experience itself is traumatic. And here comes the most delicate part. Many of the cancers discovered in this way, especially in older men, are so slow-growing that they would never cause problems during the man's lifetime. They are what we call indolent tumors. This is where two words that you may not have heard before become very important: overdiagnosis and overtreatment. Overdiagnosis means finding a disease that was never going to cause symptoms or shorten your life. Overtreatment means attacking that disease anyway, with surgery, radiation, or other therapies that carry risks and side effects, without any real benefit for survival. In the case of prostate cancer, studies show that a significant percentage of cancers found through PSA screening are overdiagnosed, especially as age increases. Europa uomo do. Now add another layer: the treatments themselves. Radical prostate surgery or aggressive radiation can be very effective in some men, especially younger ones with aggressive tumors. But they can also bring lasting consequences: loss of bladder control, changes in intimate function, and chronic discomfort. Many men end up using pads for urine leakage. Others notice a major decline in their intimate confidence, affecting how they feel in their relationships and in their own skin. For a healthy 50-year-old man with a dangerous tumor, these risks may be worth it. For a 76-year-old man with other health issues and a slow-growing tumor, the equation can be completely different. When we look at the large scientific evaluations, a clear conclusion emerges. For men over 70, the small potential benefit of routine PSA screening does not balance the frequent harms: false alarms, biopsies, anxiety, overdiagnosis, and treatment complications like incontinence and reduced intimate function. USPSTF 1. That's why several respected panels advise against routine PSA screening in this age group. But in everyday practice, many men still get the test automatically, simply because it's what we've always done. So, should every man over 70 refuse the PSA test? No, that would be too simplistic, and I don't believe in one-size-fits-all answers. There are men in their early 70s who are robust, with few other illnesses and a life expectancy of more than 10 years, who may legitimately consider screening. There are also men with strong family histories of aggressive prostate cancer or specific genetic factors for whom a more vigilant approach might make sense. USPSTF 1. The key is not to say yes or no blindly. The key is to understand what comes after the test and whether that path fits your real life, your priorities, and your stage of aging. And this is where the central tool of this video comes in, the question that protects you. Before accepting a standard PSA test after 70, I want you to calmly ask your doctor, if this test finds something, what exactly will happen next? And how likely is it that the treatment will really help me live longer or live better instead of harming my quality of life? That's the question. Simple, respectful, but powerful. It does three important things at once. First, it forces clarity about the chain of events. A test is never just a test. It's the first link in a chain. By asking what comes next, you invite your doctor to outline the possible scenarios, repeat tests, biopsies, imaging, and potential treatments. You no longer see only the needle in the arm. You see the whole movie. That alone can change the decision you make. Second, it brings your life into the center of the conversation. Notice that the question doesn't just ask, will I live longer? It also asks, will I live better? Because at 72, 78, or 83, adding a few months of life at the cost of losing independence, losing control of your urine, or losing your emotional peace may not be a good deal for you. Many men tell me, "Doctor, I don't just want life, I want life with dignity." That is what this question protects. Third, it reduces the risk of being caught in overdiagnosis and overtreatment. When your doctor has to balance benefits and harms specifically for your age and health, it becomes harder to justify aggressive interventions for tumors that are unlikely to threaten your life. The conversation shifts from, we must attack any cancer we find, to, we must carefully choose which cancers are worth attacking and how. Let me share with you a story that reflects many real cases I've encountered, with names and details changed for privacy. A man of 79 years, let's call him Ernesto, came to see me after a difficult year. He had gone for a routine checkup. He felt reasonably well, some stiffness in his knees, some nighttime trips to the bathroom, but nothing dramatic. In the lab order, without much discussion, his doctor added a PSA. When the result came back mildly elevated, he was sent for a biopsy. It's just to be sure, they told him. The biopsy was complicated. Ernesto developed an infection and ended up hospitalized with fever, chills, and fatigue. After a few days of antibiotics, he went home, a bit shaken, but relieved to be improving. Then the pathology report arrived. A slow-growing prostate cancer, the type that typically takes many years to cause serious problems, if it ever does. But the word cancer hit him like a hammer. He stopped sleeping well. He began to check his symptoms obsessively, wondering if every small ache was the disease advancing. Soon after, he was offered radical treatment. Surgery was recommended. No one spoke with him in depth about his life expectancy, about the other conditions he had, or about what it would mean, at almost 80, to lose bladder control. The focus was only on the tumor. When he came to see me for a second opinion, we did something very simple that had been missing. We stepped back and asked the question, If we treat aggressively, will you truly live longer or better, given your age and your other health issues, or are we more likely to cause complications that will weigh heavily on your daily life? Based on his test results, his slow tumor, and his overall health, the honest answer was that aggressive treatment offered little real benefit. We discussed conservative options, and he chose active surveillance, periodic monitoring, but no radical surgery. Months later, he told me, "What hurt me the most was not the cancer. It was the way no one explained what all these tests could lead to. That little question you taught me gave me back a sense of control." Now let's look at another side of the story, because I want to be balanced. A 72-year-old man, whom we'll call Luis, came to my office with bothersome urinary symptoms. A very weak stream, difficulty starting, and waking up several times at night completely drenched in fatigue. He also had a strong family history. His father died from metastatic prostate cancer in his early 70s. Luis was otherwise healthy, active, and with a realistic expectation of many more years ahead. When we talked about the possibility of PSA testing, he looked at me and asked the same question I'm sharing with you. If this test finds something, what happens next? And what would treatment really change for me? In his case, given his symptoms, his family history, and his robust health, it made sense to advance with testing and a structured plan. If a significant cancer were found, treatment might realistically help him avoid advanced disease and maintain his vitality. The same question that guided Ernesto away from unnecessary interventions guided Luis toward appropriate evaluation. The power is not in always saying no. The power is in making decisions that are coherent with your reality. So how can you bring this into your next doctor's visit in practical words? Imagine you are at the office. The doctor suggests a PSA test. You might respond like this: "Doctor, I appreciate that you are looking after my health. Before we decide, could you help me understand what this test might lead to? If it comes back a little high, what would the next steps be? And at my age and with my current health, how likely is it that those steps will really help me live longer or live better, instead of just adding more procedures and risks?" You are not rejecting care. You are asking for context. A respectful doctor will answer. If they seem uncomfortable with the question or dismiss it with, "Don't worry, let's just do it," you can gently insist, "I prefer to understand the full path before I start. It's important to me." Now, you might be wondering, if we are going to be more cautious with certain tests, what can I actually do to protect my health, my vitality, and my intimate confidence in my 70s and beyond? Because saying no to routine PSA after 70 is not the same as saying, "I don't care about my health." Quite the opposite. It opens space to focus on what truly makes a difference: circulation, movement, sleep, nutrition, emotional balance, and supportive habits that nurture your longevity from the inside out. Let's talk about circulation first. Healthy blood flow is a central pillar for the heart, brain, muscles, and intimate well-being. As we age, arteries can become stiffer and narrower, but the body still responds wonderfully to certain signals. Regular walking, at a pace that allows you to speak but not sing, is one of the most powerful medicines you can give your circulation. 10, 15, 20 minutes daily, consistently, can help your arteries stay more flexible, support your heart, and even uplift your mood. Gentle strength exercises, using your own body weight, light bands, or small dumbbells, help maintain muscle mass, which in turn improves blood sugar control and reduces the risk of falls. None of this needs to be extreme. In fact, for many men over 70, very intense or heroic exercise brings more risks than benefits. The goal is not to compete with your younger self. The goal is to give your body the movement signals it needs to stay alive, responsive, and optimistic. Nutrition also plays a quiet but crucial role. A pattern of eating rich in vegetables, fruits, legumes, nuts, olive oil, and modest portions of fish or lean protein helps manage inflammation and supports a healthier cardiovascular system. Certain foods like beets and watermelon naturally support nitric oxide production, a molecule that helps dilate blood vessels and improve circulation. They are not magic potions, but they are gentle allies that, lunch after lunch and dinner after dinner, nourish your inner pathways. Hydration matters too, especially for kidney health and circulation. Many older men intentionally drink very little to avoid going to the bathroom at night. But chronic mild dehydration makes the blood thicker and can strain the kidneys and heart. Finding a personalized balance, reducing fluids in the evening but maintaining reasonable intake earlier in the day, supports your system without overwhelming your bladder. We should also talk about rest. Quality sleep is one of the most underrated treatments for longevity. Deep sleep helps regulate hormones, supports immune function, and improves mood and mental clarity. Protecting your night means respecting a regular bedtime, limiting screens close to sleep, and paying attention to factors like caffeine and heavy dinners. If you wake up several times to urinate, it's worth discussing with your doctor because sometimes simple adjustments in fluids, medications, or habits can ease this pattern and give you more restorative nights. Beyond the physical, emotional piece is medicine. Many older men carry a silent fear of serious illness, of being a burden, of losing their place in the family or their value in the relationship. When a standard test is proposed, that fear can push them to say yes automatically. If I don't do it, something terrible will happen. Learning to pause, breathe, and ask for information is an act of maturity, not of negligence. It transforms fear into curiosity and passivity into collaboration. If you share your life with a partner, all of this becomes a shared journey. The way you manage your health decisions affects your intimacy, your conversations, your plans. Being transparent and saying, I want us to understand together what this test could mean so we protect our time and our closeness, turns a cold medical decision into a couple's project. Many women and partners feel relieved when the man they love takes an active, thoughtful role in his own health instead of drifting on autopilot. If you are a son or daughter listening to this because it concerns your father, the question applies to you too. You can accompany him to the visit and say, with respect, Doctor, could you help us see the full picture? If this test finds something at his age, what would you want to do, and how likely is it that this will really help him live longer or live better? You are not interfering. You are helping to make sure your father's remaining years are guided by clarity, not by inertia. We've talked a lot about PSA, but the deeper message goes beyond one blood test. It's about a new way of relating to medicine after 70. Instead of chasing every possible disease with increasingly complex tests, we focus on what truly moves the needle. Daily habits that support the heart, brain, and circulation. Emotional connection, and selective, thoughtful use of the medical tools that really fit your case. When a test is proposed, your first reflex should not be yes or no, but why, for what, and what comes next. If I had to condense everything we've discussed today into one sentence, it would be this. After 70, the wise man doesn't accept every standard test automatically. He asks whether discovering something will truly help him live longer and better or simply open a door to avoidable harm. You deserve health care that respects your intelligence, your time, and your dignity. You deserve professionals who speak with you, not just about you. You deserve to age with as much vitality, confidence, and clarity as possible. That does not mean avoiding medicine. It means using it as a tool, not as a destiny. And never forget this. It is never too late to regain control over your health decisions. It is never too late to start walking a little more, breathing a little deeper, eating a little better. It is never too late to strengthen your circulation, to protect your brain, to nurture your intimate confidence with habits that support your body instead of overwhelming it. Longevity is not only how long you live, it is how you live those years, whether you feel present, useful, connected, and at peace. As we close, I invite you to do something small but powerful. Think back to your last medical visit. Did you sign up for a test without really understanding where it might lead? Did you think of a question but swallow it out of shyness or fear of bothering the doctor? If so, be gentle with yourself. You acted with the information and tools you had at the time. Today, you have one more tool, that question. Use it. If this test finds something, what exactly will happen next? And how likely is it that the treatment will truly help me live longer or live better instead of harming my quality of life? If what you heard today brought you clarity, share this message with another man over 70, with a brother, a friend, or a son who worries about his father. Sometimes a single conversation changes the direction of a whole family's health story. And if you'd like to keep exploring natural strategies to care for your circulation, your prostate comfort, your energy, and your intimate confidence in the mature years, I invite you to stay close, to subscribe, and to continue learning alongside me. I'm Dr. Mary Parker. Thank you for giving me your time and your trust today. Take care of your mind, your body, and your dignity. And remember, after 70, every important health decision should begin with the right question, not just with the next test. 1. https www.uspreventiveservicetaskforce.org USPSTF Recommendation Prostate Cancer Screening UTM in source ChatGPT Recommendation Prostate Cancer Screening. 2. https://www.europauomo.org WP Content Uploads 2020-03 Structured Population-Based PSA Screening for PCA 2019.pdf.utm Source ChatGPT Structured Population-Based Prostate-Specific Antigen